We're now going to move on to our next presentation. We have two presenters who I think are going to join me on our virtual stage now to make their presentation. They're going to be talking about Joining Up Care. I'm really delighted to be joined by Alice Ainsworth, who's the head of Joining Up Care at NHSX, and also Ian James, who's the Deputy Chair of Joining Up Care Programme, NHSX, and the Care and Health Improvement Advisor at LGA. You're both very welcome. We're looking forward to your presentation, and I should say to everyone watching this conference so far today, this will be an opportunity to ask your questions of our two presenters. Really looking forward to your questions. Please do use the platform to type in your questions, and I will be able to direct them to Ian and or Alice at the end of their presentation. So I'm now going to hand over to Ian and Alice.
Good morning, everybody. I'm Ian James, and I'm a Care and Health Improvement Advisor with the Local Government Association, and very delighted at the moment to be working with colleagues at NHSX on the Joining Up Care programme.
And hi, I'm Alice Ainsworth. I'm the Deputy Director of Adult Social Care Technology Policy, and yes, I've been leading the Joining Up Care programme within NHSX for the past 8 months.
So we're here to describe to you the approach we're taking at NHS in association with the Local Government Association and the Association of Directors of Adult Social Services to support digital development in adult social care. I'll start by describing the approach we're taking to this work. The starting point for our work is a partnership approach. Next slide, please. And prior to the creation of Joining Up Care, we were already working across the sector with key stakeholders, as you can see on this slide, as part of the Digital Social Care Advisory Group. And this reflects the fact that above all else, this is a complex landscape that we're working in, and no one organisation has a monopoly of wisdom, particularly when so much at the moment depends on innovation in a fast changing world. We all have bits of the solution. Joining Up Care itself was initiated last summer in response to needs identified in the first wave of the COVID-19 pandemic. A partnership was formed with NHSX, the LGA and ADAS to co-lead on this work. In the context of COVID, the immediate need and the ambition was to accelerate the digitisation of adult social care provision through the use of digital technologies in people's homes and in care homes, essentially to keep people connected with health and care services when this could no longer be on the basis of face-to-face contact. The pandemic really accelerated existing efforts of social care to use technology, with more people, families, services and staff adopting digital ways of working and new technologies. Next slide, please. The partnership between NHSX, LGA and ADAS has helped develop a better understanding of the adult social care sector, and in particular the key statutory role of councils and directors of adult social services in shaping a care market that meets the needs of the whole population. The strength of councils is in their connectedness to local people and services and their ability to lead an agenda, bringing together all elements that impact on people's quality of life. The point being that the barriers people often face are less to do with care services and more to do with the fundamentals of things like housing and transport and access to services and opportunities more generally that most of us take for granted. The approach to improvement in councils is one which is sector-led, fostering a collective responsibility for challenge and support while emphasising the primacy of local accountability. The LGA provides the national leadership and tools to support this approach, including a care and health improvement programme with a digital support offer for which there is a link on the slide. What's really exciting about Joining Up Care is that we have the opportunity to bring the best of a sector-led approach and to combine it with NHSX's expertise in delivering national programmes. We also see it as important that we model at a national level the approach based on partnership and cross-system leadership that we equally need at local and at regional level. Next, please. Of course, all of this is about people and lives and not principally about technology. COVID has in many ways forced us back into a service mindset, and this is understandable in a crisis. But we do now have to step back and to remind ourselves about the principles that underpin good service design, including co-production and being people-led rather than service-led. If we don't, the digital revolution will further exclude people already marginalised. As we move from the tactical response to the immediate needs during COVID to a more planned strategic approach, this principle is going to be really important. It's also worth saying that paradoxically perhaps, I think some of the COVID experience for people has actually been really empowering. Giving people digital tools has helped them to feel more in control of their own health and care and how they access support. We need to understand this experience too and to build on it. Equally important, we know that most social care is delivered by families and communities. For every person who receives care through the formal care system, there are 6 more who look after themselves with the support of informal carers. These are a critical group for our digital ambitions. And many, of course, will already be using what you might call ordinary technology, Zoom calls, Alexa, wearables, etc. But we can do so much more to promote the wider potential for this ordinary technology to improve people's lives. We will develop our plans to cover this wider potential for technology across the wider social care sector. Finally, I wanted to emphasise that our approach needs to be all age. In particular, we need to avoid approaching this as an older people challenge. We have a valued community of working age adults for whom technology can be key in supporting them achieve their aspirations and fulfilled lives. We spend roughly the same proportion of adult social care budgets on working age adults as we do on older people, and they equally need to be at the leading edge of this digital breaking wave. So partnership is important at all levels, but nowhere more important than with people, families and communities. I'm now going to hand over to Alice to talk about how we intend to develop our work.
Thank you, Ian. So I'm just going to talk a little bit about the work that we've been doing at NHSX to date and about some of our future plans. And I just wanted to re-emphasize that point that Ian made there around ensuring that everything that we do puts the individual at the centre. And whether that's relating to the work that we're doing around remote monitoring, the work we're doing to put infrastructure in place, or around wider innovation and standards, we are determined that we will continue to focus on how we are supporting the outcomes for the individual that is at the centre of everything that we're doing. So we have moved forward significantly on our digitisation agenda sort of over the last year. If you could just move to the next slide, Lord Bethell talked about some of the interventions that we've made to date. He mentioned the rollout of iPads to care homes and the support for scaling the use of NHS Mail for secure information sharing between care providers and the NHS. So we want to build on that momentum, and we want to make sure that technology is an enabler for our wider social care reform plans. We want to work towards a system which has social care as an equal partner. But we are sort of also conscious that the work that we've done to date has been quite tactical, which was necessary, and we want to move towards a more strategic plan over the coming years that brings teams together to collaborate around our shared ambitions. And we have started that journey within NHSX. We've been bringing teams together, working on the future of shared care records, teams that have been supporting the use of remote monitoring across many care settings, and the work we've been doing to support care providers. We want to continue that collaboration internally, and we want to move towards a shared vision within NHSX for how we can support social care, but a shared vision that is co-produced with all of the partners that Ian mentioned. It's really important to us that all of the social care providers, local authorities, system suppliers, and people and families are involved in shaping our vision for how technology can support care going forwards. Next slide, please. So across NHSX, we are sort of taking a three-stage approach to our work across the whole health and care system. We're looking at what we need to do to overall digitize the health and care system. So within social care, we have a program of work running at the moment that is newly set up during COVID to support the adoption and scaling of digital social care records. We have done work to improve connectivity within care homes, and we're now looking at what our future plan should be to further improve connectivity, not just in care homes, but also in home care. We know that it's really important to ensure that we have got the skills in place, and we're looking at what we as NHSX should be doing to work with the Department of Health and Social Care to support the development of digital skills as part of a wider workforce programme. And one of the reasons that we want to move towards this digitised health and social care system is so that we can connect all of the bits of the health and care system together. We want to ensure that the data is flowing smoothly between care providers and settings, that we have the standards and the interoperability in place to make sure that people have got access to the information they need when they need it, and put people more in control of their own information. And then that in turn supports our transformation agenda. So that's around making sure that we have the technology in place, not just in care settings, but in people's homes, that is supporting people's outcomes and supporting the overall integrated health and care system that we're working towards. So I wanted to finish by talking about a specific example, which is one of the tactical projects that we have started during the COVID period that's actually starting to shape our future strategy. Next slide, please. So one of the projects that we initiated towards the end of the summer was in response to some work that we've done across all of our partners and stakeholders to identify what some of the most significant challenges are. And one of those challenges is around ensuring that health and care professionals have access to the information they need when they need it. We looked at what we could do tactically to support organisations and professionals over winter, and have done some work in partnership with NHS Digital to integrate GP Connect into the digital social care record systems. So this has been a partnership project, not just with NHS Digital, but also with Casper, who have been brilliant to work with in ensuring that we can get this integration in place. The work that we've managed to do so far has been with nursing homes, which we recognise is a relatively small segment of the population that we're supporting here. But what it's done is mean that we have been able to give clinicians working in nursing homes access to the GP record information for the people in their care. And what we want to do now is look at what is the work that we within NHSX need to do to give the right level of information to the right people who are non-clinical staff, our care home managers, our care managers, our care workers who are caring for people day in, day out and need access to this essential information. And what it's also started to do is open up conversations within our organisations about what is the care information that health professionals need access to, and what are the standards that we would then need to put in place to support the sharing of that information. And it essentially just gives an example of how we're working and how we want to work in the future, which is to start small and learn through doing, understand the needs of the people involved in care and in receipt of care, and make sure that the work we're doing is really iterative, that it's building on what we're discovering, we're evaluating as we go, and we're improving as we go. And I just wanted to give that example as an indication of how we are working within NHSX and how we are trying to work with our partners going forwards. Next slide, please. And just to end, I wanted to say that we recognise that we are just one organisation in amongst many, many more who have different perspectives and different priorities. And what we want to do is ensure that we're listening and that we're open to hearing alternative points of view. We want to hear about the examples of what's working well, some great case studies. Where have you managed to completely change your models of working in local areas, or what products and services are making a real difference for people? And we want to make sure that we are factoring that into our future plans and into that shared vision that I talked about earlier, and making sure that we are, as NHSX and as government, really open to challenge about what government's role should be in supporting this overall agenda. Thank you.
Thank you very much indeed, Alice. Thank you very much indeed, Ian. We're now going to have some time for some questions. So I'm really pleased to see that I've received a number of questions that people have already typed in. Please do continue with those, and we'll try and get as many of them answered as we possibly can. I'm going to start with a question for Ian. And it was, and I think probably Alice as well, you might want to respond on this, but it was, what do you think the role of government is in promoting the use of technology? In other words, what might be the key things that government could do to help continue this sort of a pace of adoption that you've been talking about?
Well, I think, do you want to go first, Alice, and then I'll come in?
Yeah, sure. I mean, I talked there about the standards and the interoperability, and I think that's something that it's really important that government takes a lead on, and ensuring that we're putting the standards in place to support the connection of all of these systems around the individual. One other aspect which I think is really important is about demonstrating what good looks like, and being very clear about what success looks like within a locality, within a local authority, within an ICS, and supporting people to learn from each other.
Ian, anything to add?
I think from my point of view, it's those things, and actually what government needs to focus on are those things that actually can only be done by government and can only be done nationally, that Alice has mentioned there, and there are other things to do with information governance and data security, etc. I think the mistake sometimes for government is actually to think it can manage this, and actually what it needs to do, I think, is create the conditions where local innovation can thrive. And it's an interesting world, isn't it? Because actually there is no script for this. We're talking about a fast-moving world where actually it's about the ability of people to see the opportunities and to innovate. And typically government's not good at that. I mean, it's what I would say. Innovation comes from people who are using services, who are familiar with services and know what some of those solutions are. So I think the other role of government is to try and create the conditions where it's actually promoting that local creativity and innovation.
Thank you very much for that. And Ian, actually, one of the things you said in your presentation was how COVID has maybe caused people to pivot more to a service way of thinking than a people-centered way of thinking. What do you think are the things we now need to be watching out for to make sure that we don't stay in that habit of focusing on the service rather than the people?
So I think the danger is that actually we will need to go around quite a long route to relearn some of the things that actually we've learnt once or twice before. And in essence, that is, we've gone through phases in the development of adult social care where we have become very service focused, and we've actually needed a jolt from people using services and carers to say, actually, this is not working for us. We want personalised services that we're in control of. And in a crisis, you naturally try and maintain your services. Essentially, that's what you have to do. And I'm slightly anxious that actually if we continue too far down that road, we will then not be working in the way that the best of adult social care does with people who use services and families and communities. So it is about co-production. It also links to the point about things needing to be local, because actually change happens locally. So I think the things that we need to get back to, if you like, the principles of good service design, is that you work with the people who use services in order to provide service that meet their needs.
And actually, I've just seen we had a question from a colleague, I think from ADAS in the West Midlands, and they've said how much they welcome working with both the LGA and NHSX, and they're developing a regional pilot to look at how to co-produce and involve all partners in social care to contribute and embrace digital opportunities. And the question was just, can Alice and Ian say something about how this might develop? So that sort of model of working, and which of you would like to start?
Yeah, absolutely. I mean, it's been a real eye-opener for me working in partnership with the LGA and ADAS over the last 8 months. It's been incredibly helpful in supporting and challenging all of our plans and making sure that we continue to check ourselves to make sure that we are really understanding, you know, the role of central government, the role of local government, that we're sort of constantly going back to look at the question around the social care system rather than the individual, making sure that we're focusing on prevention and thinking about how we can support people without those formal care needs. And actually the work that we're going to be doing going forwards is looking at how we can continue to expand that model. And the pilot that we're going to be leading in the West Midlands, that's a joint partnership with LGA and ADAS, is going to be around how can we make sure that we are more in tune with the needs of a local area, and how can we make sure that we are listening to the local priorities and understanding how we can support local areas to achieve more with the support of central government.
Ian, anything you'd like to add at all?
Yes, please. And I'm really pleased that we're going to be able to do the work in the Midlands with ADAS. One of the issues I think that's come out of COVID is actually there's so much now happening in the digital innovation space for adult social care, NHSX, NHS England and Improvement, local government doing its bits. There are things happening nationally and regionally, and the constant feedback we get from local people, and this is from adult social care providers in particular, but councils as well, is that actually it's difficult to understand at the moment what is happening and how they effectively engage at the local level with all the different initiatives. So I think actually this is another issue for government to some extent, is actually creating a narrative about what our ambitions are and how the various bits of the jigsaw fit together. And our work in the Midlands is about actually trying to bring together all those leadership interests at least a level which is below national level, to try and coordinate all the different aspects of the work that we're doing, and working alongside social care providers, councils and the various NHS bodies to make sure that we're optimising all the resources that we are putting into this ambition.
And I guess one of the questions that's come in, which is in a way the other side of that, sort of, I can see from the point of view of public sector organisations needing to have that level of sort of clarity and coordination around all the different aspects of activity in this space. But we've had a question saying, as a startup and new TSA member, what is the best way to get involved with the social care reforms, particularly with NHSX? And the question also refers to some amazing outcomes they've had from the platform they've been developing. So I think how can those that are developing new service models, those that are developing new innovations, best interact with yourselves? So I don't know which of you'd like to start. Maybe Alice?
Yes, absolutely. I mean, contact details are there for people to get in touch directly. But I mean, what I would recommend is making sure that Alison and her colleagues have all got visibility of these great case studies, and making sure that the voice of TSA is helping to sort of challenge government and challenge NHSX, and make sure that we are hearing those broad range of examples.
Anything to add, Ian, at all?
Nationally, I think, I mean, we are working very hard to work with TSA and others who represent suppliers and care tech, because as I said at the beginning, we recognise that actually a lot of the ideas and innovation actually will sit in that sector, and to some extent this is about it's trying to make the best of the national initiatives, but actually there's a kind of bottom up bit actually, I think, and I mean bottom up as in if you're a small supplier, then you will have your views about actually what things are needed and what can work. So we're very keen that actually we are using our national ambitions and the way that we frame a strategic approach, which is very much rooted in people's ideas and experiences locally and from within their own businesses.
Thank you both very much. Just a couple more questions, I think, and then we probably will be moving on to our next presenter. But the question, you both talked about data, and indeed data and the flowing of information has been very much a theme of the presentation so far this morning. And the question that I've got here is, clearly access to data in a timely manner shared across the system is crucial. The culture change for this is significant. How can we ensure GPs, and I would say probably others, and practice managers for GPs make the use of this information and don't see it as a burden on their roles? Alice, would you like to kick off? Maybe I'll come to Ian after that.
Yes, absolutely. I mean, I completely accept that point. I think that there's an awful lot of work that will need to be done around information governance, and not just the IG, but also the culture and trust elements that sit around that. I completely agree that is one of the significant challenges that we've got here. I think from my perspective, the plans that I mentioned in the presentation there, the intention is very much to make sure that we are collaborating and co-producing with those other partners as well, ensuring that primary care professionals and the bodies that represent primary care are part of those conversations around what are our needs and what are our priorities, and how do we ensure that we've got the information standards and roll them out in a way that works for everybody that's involved.
And Ian, anything you'd like to?
Two things very quickly. I think the first one is that actually to ensure that adult social care continues to be part of these discussions. We know the healthcare world is complicated enough and is not entirely digitised, and so sometimes discussions tend to let's sort out the NHS first and then we'll deal with social care. So I think if nothing else, COVID has shown us that they're inextricably intertwined, and therefore on the data side too they need to be dealt with in that way. I mean, my other thought is that I think ultimately, and people will say that the information governance issues are to do with local relationships and trust, they're not inherent in what information governance restrictions we have or permissions at the moment. Ultimately, I think though we have to move to people controlling their own information and data, and therefore effectively the permissions come from the individuals themselves. So it's less about services sharing, it's more about the individuals, how we make individual people put them in control of their own data.
Thank you very much. And I think that point about making sure that social care is a forethought, not an afterthought, in terms of the ongoing development of a strategic approach to this is really, really an important message that I'm sure the sector would want to echo. Just really one final question on data, which partly builds on one of the points in the recent white paper about new expectations and indeed new, I think, duties around provision of information from within the care sector. I just wanted to ask, do you plan to obtain permission for data sharing between the end user of TECS, social care, TECS providers and NHS, where the end user is not in the social care system yet? In other words, Mrs. Smith, for example, has had a Lifeline purchased by her family because she's had a fall, but no social work team has so far been involved. So these are people who are not yet known to services, but do become known to technology-enabled care service providers. Just wondered what your thoughts were on how that might be part of the data mix that we've been talking about. Maybe James first, then Alice.
Well,
then Alice.
So, I mean, in a sense, this is the point I made previously, Paul, which I think in a sense, the answer to this is for individuals to be in control of their own data. And that's actually what we need to build into our strategic thinking going forward. And I'm conscious that actually I think there are a whole lot of issues around how we can beneficially actually use lots of areas of data to improve services and to plan services, but actually go well beyond the data sharing agreements now that kind of featuring in information governance. So unless Alice knows different, I'm certainly not aware that that's actually part of any plan, that in a sense that we start, as it were, to mine data that is being obtained from as it were the vast majority of the population who support themselves with their families and carers.
Yeah, I mean, just to yeah, agree with Ian there. There is actually, just to mention to everyone that's watching, there is actually a data strategy that Secretary of State trailed last week in a speech to the Rewired conference. That's going to be published as a draft rather than as a final document. And I would encourage that when that happens, that people participate in responding to that draft data strategy, and ensure that if there are any areas where government is not clear enough, or that you want us to go further, that you are sort of actively involved in shaping the data strategy going forwards.
Thank you very much for alerting us to that. I'm sure that the TSA and our members are going to want to respond to that. Yeah. Indeed, back in 2019, when we published our leadership report, which was after a significant amount of engagement with people across the health, housing and social care sectors, one of the things that came out very strongly was the important role that data can play when it flows well, and actually the idea that data from the tech sector using the NHS identifier could be one of the ways in which we can further enrich the insights that sort of population health management approaches are meant to be looking to develop. So we think there's a huge or significant contribution that the sector can play to provide additional insight because of its very early relationships with people who may become better known to care services at a later point. So thank you both very much for your presentations, for setting out the agenda that you've been working on around joining up care. Really appreciate your time, Alice and Ian. Thank you both very much.
Thank you.
Thank you.